categories, factors that affect the BP, and then impact, of hypertension. But we'll talk about hypertension um, in the second stage in the second presentation. All right. So by definition, blood pressure is that pressure or force exerted by the blood on the blood vessels, that is the arteries this time around, as it flows from the heart to the organs. All right, so it's that pressure exerted by the blood on the blood vessels as it flows from the heart to the organs. Usually, when the heart is beating, it has to, uh, move on with a pressure. It has to beat with such a force that will make the blood to flow, to keep flowing. All right. So that force exerted by that blood that is coming out from the heart is called blood pressure. So the blood and its pressure. All right. It's coming from the blood. All right. And it's exerted on the arteries. The source of the blood is the heart as it pumps. All right. Blood pressure has two components: the systolic blood pressure, which is the upper number, and the diastolic blood pressure, which is the lower number. All right. So, just a way of knowing it, I mean, because patients confuse, oh, my diastolic. While they're talking about it, they mean actually the systolic. Some also will just mention when they say my blood pressure is 110. And I'm like, what's the next one? The lower one. Many people don't pay attention to the lower reading, but it's extremely important as well. So systolic blood pressure is the upper number, diastolic blood pressure is the lower number. Systolic, upper, superior. So if you remember, S for systolic, S for superior. All right, very, very simple. And then diastolic, down. If you remember, D for diastolic and D for down. All right, you should not have any issues with that. So S for superior systolic blood pressure is the upper number. Down for diastolic, which is the lower number, and it's is the down number of the two. All right. Systolic blood pressure is the pressure, the force exerted by the blood as the heart pumps the blood. All right. While diastolic blood pressure is the pressure exerted as the heart relaxes to receive from the veins this time. All right. So while the heart is at rest, blood is still moving. The force is still on so that it can reach the organs. It can reach, its destination. While the heart is at rest, receiving blood from the veins, if we remember our biology, arteries take blood away from the heart, while veins brings blood to the heart, all right, from other parts of the body. So when the heart is at rest, relaxing, so to speak, receiving blood from the veins, all right, there's a pressure also being generated, and that is the diastolic blood pressure. Both of them are very important, and please pay attention to both. Many people think that the systolic blood pressure is the all in all. No. So this is what I mean. The blood pressure can be 120 over 100. The systolic is normal, but the diastolic is elevated. If you only pay attention to your systolic blood pressure, that's the superior one, the upper one, and you do nothing about the diastolic, you don't reckon with it, the blood pressure can be high, diastolic will be high, and you'll be happy that, oh, at least my blood pressure is 120. No, 120 over what? It's reading 100. That 100 is high, and you've got to do something about it. Generally, those below 60, more or less, tends to have the diastolic as the major driver. All right, so the diastolic blood pressure increases, gets high, and the systolic can be normal. The elderly, 65, 60, 65, 70, they tend to have more of, systolic blood pressure. If they're going to have any isolated hypertension at all, if they're going to have any isolated increase in blood pressure, all right, it's likely going to be the systolic because of the stiffness of the arteries as they age. That's as a result of aging. So sometimes you hear somebody saying that the blood pressure, and maybe, for those of us who have, elderly ones, the blood pressure is 150 over 70. And people often complain to me that, oh, it's papa's higher value, higher number that is always, increased. All right, they say that, oh, the systolic is 150 at home while the diastolic is 70, sometimes 75, but never crosses 80. But why is the systolic high? The systolic is high because of the stiffness of the arteries as one ages. As we age, the skin gets wrinkled and things like that. It's also affecting the blood. The blood vessels is affecting the arteries as well. All right. So pressure, systolic blood pressure is the measure of this pressure within the arteries while the heart beats. I've talked about it. Okay, while the heart is contracting, you can see the heart here is contracted here, is beating. All right. Diastolic blood pressure is the measurement during the pause between heartbeats when the heart relaxes. When it relaxes, blood comes in. All right. And when blood comes in, it now beats and blood goes out. Okay. So diastolic blood pressure is as important as the systolic blood pressure. All right. Blood pressure fluctuates from minute to minute. Okay. So our blood pressures can fluctuate. That's why if you take the blood pressure now, in the next, 5 minutes thereabout, if you take it again, it may not give you the same reading, but it should not be far apart. So if you have one that is maybe 120 over 70, you take it again, it can be 122 over maybe 71 or 122 over 68 or things like that. It's a dynamic thing. The heart is always beating. So this thing can change. All right. But it should not be significantly different from one another. So you shouldn't get a blood pressure of 120 over 70 now, and when you check it in 5 minutes time, it's reading 150 over 100. There's something wrong somewhere. Either the way you've checked it, your method, is wrong. Something has gone amiss, or the batteries of your device is weak, and you will need to change it. All right. So it's important. And then we need to also know that sometimes you may need to measure. In actual fact, we talk about measuring about 3 times and getting the average. So you measure your blood pressure 3 times, get the average, and then you can write it down. All right. Now, blood pressure shows a circadian rhythm over a 24-hour period, higher in the day and lower at night. Now, the way I explain it is this: in the day, there we have activities, we are moving around, we're doing a lot of things, so the heart is constantly, facing that challenge of supply blood, supply nutrients, and this is activity time. In the night, activity reduces. As you plan to go sleep, the system tells the heart as well that, look, we're going to sleep. And so the pressure begins to reduce. The blood vessel relaxes, all right, pressure begins to reduce. And that's why, if you check it very well, for those who measure their blood pressure in the morning and at night, you will find out more often than not, all right, that the readings in the mornings are quite higher than the readings at night. All right. But that said, we still don't want it to be elevated. All right. So you shouldn't say, oh, well, it's morning time, my blood pressure is 150 over 100, no problem about it. No, you've got to do something about that. That is high. All right. It shows circadian rhythm. In the night, if your blood pressure is high at night, it has no significance. We do not expect that blood pressure should be high at night. All right. But if it does, then you need to really, really deal with it. You need to see your doctor as soon as possible or get in touch with a cardiologist as soon as possible. When you are sleeping, the blood pressure is supposed to go down a little bit also. So we do something called there's a device we use to measure blood pressure that, even when sleeping, it can check the blood pressure, ambulatory, blood pressure measurement. All right. Now, when one is sleeping, the readings that we're supposed to get at that time should be lower than in the day when the person is active. And usually the blood pressure drops it should drop more than 10% of the values in the day. During the next session, know your blood. Let's talk about your blood pressure too. We will delve into that, more. But because we're talking about circadian rhythm now, I just feel that I need to make this clear to us, because patients come and they say, oh, my blood pressure at night is normal, but the one in the morning or in the day is just high. I don't understand. It's because of the circadian rhythm. All right. Now, that said, another thing I want us to know is that there's usually mild variation in the blood pressure between both arms, usually less than 10 millimeter mercury. So, if you check your blood pressure, the one on the left, it may be 120 over 75. And then you check the one on the right, maybe it's 122 over 76 or something. Nothing to worry about. All right. As long as it is less than 10 millimeter mercury. If it is more than that, then something is happening somewhere. Maybe there is, what we call atherosclerosis. The blood vessels being clogged by cholesterol, all right, on one side, all right. Maybe the right side is having the issue and the left side is a bit freer, or the rate of, atherosclerosis in both hands are not the same. One is outpacing the other. Then that something is wrong somewhere. You need to see your doctor so that they can help you to really, really decipher what is going on. It's very, very important. There are minor variations between the left and the right. More often than not, the right arm, measurement tends to be a little bit higher than the left. All right, more often than not. But that does not mean that it is always the case. Like I said, things can happen, atherosclerosis, few other things and things here and there that can make, that to go on. The only way to know your blood pressure is by measuring it. Please. I hear people say, I know when my blood pressure is high, I'll begin to feel uneasy. My head begins to do somehow. I have headache and this and that. It's fine. But the only way to know your blood pressure specifically is by measuring it. And there's no point waiting for signs to know whether your blood pressure is high or not. By the time you begin to wait for signs, and when you're feeling headache, you are having a bit of, features of being unwell, your heart is, maybe racing and things like that, you've already moved far. I can tell you that you've already moved far. It means that this has been for a while. All right. Please check your blood pressure regularly, especially if you're hypertensive. Check your blood pressure regularly. Don't wait for signs. Don't wait for things to happen. For example, hey, it seems as if my blood pressure is high. Let me quickly check it and let me take my drugs. Now, those who say that are also those who don't take their drugs regularly, from my practice, from experience. All right. If somebody says, oh, I know when my blood pressure is high, I know when my blood pressure is high, it means that they don't take their drugs regularly. They take their drugs only when it is high. And that's another dangerous thing. All right, you've got to take care of your blood pressure so that you can have rest. All right, we're going to delve into that next, during the next episode. All right, it's very, very important that we know that. All right, now let's look at blood pressure measuring apparatus. Now, presently there are, three major ones. We have the mercury sphygmomanometer. All right, it makes use of, mercury. You have to pump, inflate the cuff, and then you use your stethoscope. It's going out of fashion now. In actual fact, in so many, countries, it's been phased out. And one of the reasons is because of the mercury, the carcinogenic, potentials of, mercury. So it's been phased out. Now there are aneroid sphygmomanometer. All right, it has like a circle, a wall clock, like a clock, like measuring device. All right, it also makes use of the cuff. You have to, inflate on your own and reduce the, put your stethoscope and then measure. All right. Now the third is the digital sphygmomanometer. All right, that one you just, press. It does the measurement for you. You don't need anybody to put the stethoscope there. It does the measurement for you. But one thing about this is that you've got to make sure that your batteries are not weak. If the batteries are weak, it can give you false readings. All right, so please, when you want to check your blood pressure, make sure that you have, batteries that can do the work. Okay, and if you notice that the readings are, fluctuating, like I said, check about 2 or 3 times, and then take the average. If you check your blood pressure, now it's 120 over 75, and you check the next moment is 150 over 100, you know that something is wrong somewhere. You should change the batteries at least, and then recheck. All right, something is going on somewhere. Now, the digital sphygmomanometer is such that, the one that is being shown here is the one that, you put around your arm. The brachial arteries is still the target there. All right, but we now have the wrist one. We have one that can measure. You just put it on the wrist. Now, the one that you fix on the brachial artery is far more sensitive. All right, and fairly more specific than the one on the wrist. All right, the wrist sphygm is just to give you an idea. It may not really measure properly. All right, you should get the one on the arm. Okay, the the, the slight advantage of the one on the wrist is that it's not as big. It's not a cumbersome, instrument. You can put it in your pocket. You can just, at any time, you can bring it out and just put it on your wrist, and then do your measurements. All right, but it is not as, accurate. Yes, that's the word. It's not as accurate as the brachial one, this one that I'm showing here. For us, that is important for us to know. We should also know that there are other, pressures in the body that can be measured. But the one that we measure outside, the systemic blood pressure, is what we're dealing with today. You may, be reading and you see something like pulmonary, pulmonary pressure, all right, portal pressure, and all that. These are pressures internally. We're not, dealing with that now. Even in the eyes, there are pressures. We talk of, ocular, pressure. We're talking about systemic blood pressure at this time. All right. Now, how to measure your blood pressure, accurately. And this is, something we should, really, really pay attention to. Number one, don't have conversation, when you are checking your blood pressure. Some people will, put it on, the device is measuring and they are busy talking. No, it can elevate your blood pressure from 5 to like 10 millimeter mercury, and you know that that can, I mean, if your blood pressure is supposed to be 130 or 132, and while talking, it gives it another 10, you know that, I mean, you crossed to 140 something and you may be alarmed. So please maintain a quiet environment, be relaxed before you check your blood pressure. And while checking, make sure that all conversation stops. Or even before you check, don't talk, just relax, and and that will be fine. Support arm at heart level, it's important. Unsupported arm has up to 10 millimeter mercury. So your hand should be at at the heart level. All right, just the way this is being illustrated here. This person is well seated and the hand is at the heart level. All right, put the cuff on bare arm. Okay, thick clothing adds up to 5 to 50 millimeter mercury. If you have a thick clothing, for some people, they're not able to really roll up the sleeves. If you cannot roll it up, please just put up that cloth, all right, and check your blood pressure properly. If you're wearing a tight, clothing, and you want to measure your blood pressure with it, it can give you something, that is not accurate, all right. Now, use the correct cuff size. Okay. If you use the one that is too big, it can underestimate your blood pressure. If you use the one that is small, it can overestimate. Okay. It can exaggerate your blood pressure. The blood pressure can go up, more than it should. All right. Support your feet. Don't leave it hanging. All right. Make sure that your feet are on the ground. All right. They're on the ground. Okay, it's important. Well, if you're lying down on the bed, no problem about that. We have what is called supine blood pressure. No problem about that. But when you're doing that, the measuring device must be at the heart level. So as this man is seated now, all right, the measuring device should also be on that support system at heart level. All right, it will be wrong if you put it above. Okay, if you put it above, because of the effect of gravity, it will affect your reading, and if you put it below, it will also affect the reading. All right, keep legs uncrossed. If you cross your leg, it has a way of impacting on your blood pressure. Empty your bladder. Make sure you are not pressed. If you are pressed, go and ease yourself before you check your blood pressure, because if you do while you're pressed, while your bladder is full, it can also add on to your blood pressure. And then support your back. Don't sit without, relax. So you can see that in this picture, this person's back is against the chair. Okay. Hello, can you hear me? Please, can you hear me? All right. Okay, thank you. So make sure you sit well supported, your back behind your chair. All right. It's better not to stay suspended. All right. That is very, very important as well. Okay, let's go on. So what is normal blood pressure range? All right, normal blood pressure is between 90 to 120 systolic, and then 60 to 80 diastolic. All right, so 90 to 120 systolic, and then 60 to 80 diastolic. Like I said, both parameters are important. Systolic blood pressure, for those who joined a bit late, I talked about the fact that systolic blood pressure is the upper one, diastolic blood pressure is the lower one. Systolic, you can, a very simple way to remember it is systolic, superior, higher figure. Diastolic, down. D for diastolic, D for down. So it's the lower figure. All right. It's the lower measurement. All right. Now, the normal blood pressure is between 90 to 120 systolic, 60 to 80 diastolic. All right. Now, If the blood pressure is out of range, it can either be elevated or reduced. The commoner that we face globally is elevated blood pressure. Elevated blood pressure is the same thing as hypertension. So you ask some people, are you hypertensive? They say no. And then by the time you say your blood pressure, does this go up? They say yes. My blood pressure used to be high. I'm on medication. If your blood pressure used to be high, it means that you're hypertensive. It's the same thing. Elevated blood pressure is the same thing as hypertension. All right. Now WHO puts the figure at 140 over 90 and above. 140 over 90 and above. In the US is 130 over 80 and above. 130 over 80 and above. All right. So we need to know that. Hypotension, on the other hand, it's less, common compared to hypertension. It can exist, but it is less common, far less common, and usually something will predispose to it. All right. Low blood pressure is the same thing as hypotension. All right. And it is a blood pressure less than 90 over 60. All right. So if the blood pressure is 88 over 54, 82 over 40, I mean, that is quite low. Okay. And in the next session we'll talk about the symptoms of both, how both can present and things like that. All right. Of course, in this particular know your blood pressure, let's talk about your blood pressure. We will eventually end up discussing hypertension. Okay, because that's the one that that bedevils most people. All right, that's the one that is far more common, and globally it's a concern. It's even the number one risk factor leading to death. All right, so factors are affecting blood pressure. Age can affect, blood pressure. Obesity. So as one ages, the blood pressure tends to go up. Why? Because of the increasing stiffness of the arteries. All right. And that generates increased pressure within. All right. So age, obesity, the more obese one is, the likelihood of the blood pressure being elevated. All right. Because with obesity comes atherosclerosis that reduces the lumen, reduces the capacity of the blood vessel to dilate, and that goes on to impact on the blood pressure. Exercise will increase your blood pressure. All right, that's why it's important for those who want to take on one sport or the other. You will usually be told, oh, go for your medicals. If you hear that, oh, an athlete is doing medicals, is doing this and doing that, they're trying to check how fit that person is, and they're going to also subject the person to exercise stress test and all the rest. Illnesses, there are some illnesses that can increase blood pressure. There are illnesses that can reduce blood pressure as well. And of course, medication, some drugs can as well. For hypotension, bleeding, if one is bleeding, all right, the blood pressure will eventually go down, okay, because of reduced blood volume. Burns, with burns, there can be, hypotension because of loss of fluids from the, surface area, especially if it's an extensive burns. The person can come down with, low blood pressure. Vomiting and diarrhea can also reduce blood pressure and cause hypotension. Irregular heartbeat, arrhythmia, we call it arrhythmia. If it's very, very fast and the heart is not having enough time to receive blood in, all right, during the relaxation phase, the person can come down with, with hypotension. Some people during pregnancy also experience hypotension. All right, pregnancy can go either way. In short, in any of the three, most people will have normal blood pressure during pregnancy. Some will have elevated blood pressure during pregnancy, and once they deliver, the blood pressure comes down. On the other hand, some experience low blood pressure during pregnancy. All of this are as a result of hormonal play. All right. So factors that affect blood pressure, again, diseases, age, heredity. Okay, so genetics has a way, I mean, something to play in this. If you know parents are hypertensive, the chances of the offsprings to be hypertensive is very high. If they have normal blood pressure, that's also, I mean, a possibility. The chances of the offspring having, hypertension will be reduced. That does not mean it's completely eliminated. During the next phase, we're going to talk about that, because lifestyle can impact on it. If the blood pressure is low, all right, I mean, that can also impact. So blood volume, all right, increased blood volume will cause increased blood pressure. Weight will cause an increase in blood pressure. Diet, if you take a lot of salt and salty things, condiments can increase. Hormones, hormonal play, that's chemicals in the body, can impact on the blood pressure. Caffeine, of course, will increase blood pressure. Environmental factors, noise pollution and things like that, they can increase blood pressure. So please limit your exposure to noise. Is very, very important. Psychological factors. Okay, somebody that is stressed, somebody that is going through some challenges, the blood pressure can go up. Anxiety will increase blood pressure. Gravity. All right, so those who are in mountainous areas, high up, the chances of having increased blood pressure is there compared with those who are not living in mountainous areas. We've talked about drugs. Alcohol can increase blood pressure. Time of the day, we've mentioned that circadian rhythm. So in the day, the blood pressure can be high. At night, I mean, the blood pressure is higher in the day than in the night. All right, doesn't mean that you should have elevated blood pressure in the day, and if your blood pressure is elevated chronically or consistently or persistently, it means that you have hypertension, not that you possibly have. And it is better to own up. People tend to live in denial or say, I reject it, it's not my portion. It's nobody's portion. I mean, this is just simple medicine, simple science. And the earlier you settle within yourself and get to meet your doctor and work out a plan of how to control the blood pressure, the better for you. Ethnic origin. Okay, black race tends to have more elevated blood pressure than Caucasians. Humoral mediators. Okay, these are chemicals. Okay, adrenaline, noradrenaline, thyroid hormones and co. These are I mean, chemicals that can impact on your blood pressure, whether it will be high or not. Vascular caliber and reactivity is also something that can. So if your blood pressure contracts more often than not, if your blood vessel, rather, if the resistance, the peripheral resistance of your blood pressure is high, the chances of your arteries is high, the chances of your blood pressure to be high is very, very, I mean, Okay, can you hear me now? Sorry, I think there was a bit of issue there. Please, if you can hear me, just kindly write a yes. Okay. Can you see my slides? So the blood pressure is extremely important. It's something we need to know. It's something we need to, be aware of. Things that impact on your blood pressure. Very important that we get to know about them. Very important that we get to know about them. Oh, the slides are not showing. Okay, very in a minute. I'm going to put it up again for us to see. Apologies. Can you see my slide now? If you can see it, please just type yes. Okay, thank you very much. All right, so I was talking about the blood viscosity. Blood viscosity, if the um, red blood cell is so much, if the white blood cell is so much, especially the red blood cell, if the viscosity, if it's not, if it's very, very choked up, let me use that word, the pressure it will impact on the vessel will be high. So increased blood viscosity will increase your blood pressure. Cardiac output will increase your blood pressure. So you really, the formula for blood pressure is cardiac output times peripheral resistance. For cardiac output, that is the amount of blood that's being pumped out by the heart. All right. And cardiac output is determined by the stroke volume, all right, and the heart rate. The heart rate is the amount of time the blood, the heart beats. All right. While peripheral resistance is the how narrow or how wide the vessels are. So if the vessel is narrow, all right, the chances of the pressure going up is higher. All right, this is something we should know. So it's depicted better here. Blood pressure is cardiac output times peripheral resistance. And there are so many things that can affect the cardiac output and affect the peripheral resistance. Salts can affect, the peripheral resistance, make your blood vessel to constrict and increase the blood pressure. Okay, if your blood volume is high, the cardiac output will increase. If your heart rate is high, the cardiac output will increase. Now, let's listen to um, this very short video clip as we begin to bring this session to a close. Just watch it. So rest, relax, be seated, your chair well, placed, your arms well positioned, correct placement of the cuff, very important. You turn on the device and you make sure that you are in a very, very quiet place. And then display that the numbers will be displayed. Avoid talking, we've talked about that. No tight clothing, we've talked about that. So it's extremely important that we do this. It's very simple to measure. It's very simple and then you can document it. The third figure there is the pulse rate. So you have the first figure is the systolic blood pressure, superior, if you can remember. The second figure there is the diastolic, down. And the third one there is the pulse rate. Your pulse rate is also very important. We won't talk about that now because it's the blood pressure we're really dealing with. But if you remember this, that cardiac, then you should know that if the heart rate increases, which is also your pulse rate, if your heart rate increases, your cardiac output may increase, and your blood pressure may increase. All right. It's not the norm every time, but that can happen, just for us to know. Let us stop here for today. I want to believe that we've, gotten something. Thanks for listening. God bless you. If you have questions, you can, raise your electronic hand, so that you can be given the opportunity to ask your question. While we're getting ready for questions, for those who may have questions, host, kindly help me unmute Dr. Donye, just for him to contribute to this and give us one or two things that he may want to say.
Good evening, sir.
You're welcome. Yeah. Good evening.
I think everything has been put together appropriately, and the summary of what we heard today is just to help us know how to measure the blood pressure and those things that could give errors while we're measuring the blood pressure. And also, emphasis has been laid on things that we can do in terms of lifestyle that can affect the blood pressure, and all of those things are important, which will go hand in hand with the use of our medication. So I hope we'll be able to make it of the vital information we have today to make our heart better. Thank you.
Okay, thank you very much. All right, questions. I think there are some questions in the chat box. I think Dr. Ndeye have attended to some of them, who attend to the others. But if you have questions, you can raise your electronic hand so that we can you can have the opportunity to speak. You have any question, raise your electronic hand so that you can be given the opportunity. Okay, I can't see any hand raised up. So, okay. Shedrack Oreku, are you asking a question? Your mic has been unmuted.
No, I don't have any question at this time. Good evening.
Okay. Yeah, good evening, sir. You're welcome. All right, thank you very much. So you can help us mute. Okay, thank you very much. All right, let's look at the chat box. Seems as if there are no, physical or live questions, and I think most of the questions have been answered. Premenopausal, postmenopausal stages of life. Can it affect blood pressure? Yes, it can. All right. Oh, apologies about that. Thank you, doctor. Though the network was bad. Sorry about that. We'll make it better next time. Apologies. Okay. My question is why a normal VPN? I don't know. But elevated pulse rate. Okay, normal blood pressure, I guess you wanted to write, an elevated pulse rate. Yeah, it's possible. Sometimes the pulse can be high as a result of so many things. All right. Anxiety, for example, can make one's heart to beat very fast without the blood pressure significantly changing or increasing. All right. And then that can impact on your blood pressure. So overall the pulse rate can be high. Sometimes it can be very high, and because it is extremely high in the setting of arrhythmia, if the heart rate is extremely high, let's say 150, at that time of course the person will have palpitation, okay, or 140 thereabout, the blood pressure may be low instead of high. Reason being that there will be no enough time for blood to fill the heart. So when the diastolic phase, the phase where the heart relaxes and blood gets in from the veins, will be shortened. And when it's reduced, the stroke volume will reduce and the cardiac output will greatly reduce. And when the cardiac output reduces, remember cardiac output times peripheral resistance. If the cardiac output greatly reduces, the blood pressure will reduce. Please, are there situations where the pulse is higher than systolic and diastolic? Okay, now I've just mentioned that you're talking about the pulse rate. The pulse rate, increases, and the blood pressure may be normal. It's possible. All right, it's very, very possible. Yes, the pulse can be high. Okay, I think it's been answered already. I don't know if there's any. I'm trying to check the chat box, but if you have, okay, Oladeji Olubumi, please host, help us unmute Oladeji Olubumi.
Hello, good evening, sir.
Good evening, ma.
Yes, sir. Please, I want to know that is blood pressure responsible for vascular resistance? Vascular resistance.
Okay. The vascular resistance, on the other hand, can impact on the blood pressure. So if the vascular resistance is high, the peripheral resistance will be high as well. I mentioned it, I think. Okay, so this is it. So this is peripheral resistance. If the peripheral resistance is high, the blood pressure will be impacted upon, because it is the second major factor that determines your blood pressure. So if your vascular resistance is high, all right, if the cardiac output remains the same, your blood pressure will increase. Okay. I hope that answers your question.
Yes, thank you.
Right. Thank you. You're welcome.
Okay.
All right, Joy Emmanuel Ememe. Help us unmute Joy Emmanuel Ememe. Host, kindly unmute Joy Emmanuel Ememe. Okay, please, can you just touch your audio button? I'm sure the host must have given you the opportunity to unmute yourself. So touch your audio button, Joy, and you'll be unmuted for us to hear you. I hope you know where your audio button is. The host has given you the opportunity to unmute. Click that unmute notification there. Sorry, if you are having issues with unmuting your mic, you can put your question in the chat box. We will answer it. Okay. What is the normal pulse rate? Okay, apologies that, well, I didn't mention that because we're talking about blood pressure, but the normal pulse rate is between 60 and 100. Normal pulse rate between 60 and 100. Okay, fine, it's been answered. Thank you, Doc. What are your recommendations for someone with elevated blood pressure? I'm sure, okay, that has been answered as well. Thank you, Dr. Noye. If you have low pulse and low breathing, what can you do? Low pulse and low breathing. I don't understand what you mean by low breathing, though. But if you have low pulse, there are, you need to see your doctor. Your doctor will need low pulse rate. Okay. Hormonal interplay. All right. For example, if your thyroid hormone is not functioning maximally, all right, your pulse rate, your heart rate can reduce. Okay, that is one. Two, there is what we call the electrical activity of the heart. If the electrical activity of the heart is getting weak, all right, the pulse rate can also reduce. So there are quite a number of things that can cause that low pulse rate. Slow breathing. If somebody has slow breathing, you need to see the doctor. You have low pulse rate and slow breathing. Although I would have loved to ask you questions about what you mean by slow breathing, but ultimately you need to see a doctor so that you can be properly evaluated. After a few workouts, I noticed a slight swelling on my feet. I think that has been answered. All right, fine. That has been answered. Can anxiety cause an elevated blood pressure and increasing, pulse rate? I think that has been answered as well. Please, you have skipped some questions. Okay, we'll try and go back and check. When an is placed underneath the tongue. Okay, when aspirin is placed underneath the tongue of someone who feels sudden collapse of jaw, how long does this sustain the patient before getting to medical facility? Aspirin is not a wonder drug. All right. So aspirin can be chewed in some cases if we're thinking of heart attack by the side, heart attack is looming. All right, we tell the patient take aspirin, chew it, not put it under the tongue. All right, that putting it under the tongue will not do anything. Aspirin can also be used to prevent stroke, especially ischemic stroke, is what we call ischemic stroke, and to prevent recurrence for those who are predisposed, and to prevent recurrence of stroke. All right, for those who've had ischemic stroke. Well, we'll talk about that in some other listing. Aspirin, many people, and I think I need to answer this because I think I need to address this, and I don't know where they got it from. Or if your blood pressure is very high and you're taking aspirin, you are endangering your life. Because what it means is that if you have any bleed in your brain, is going to be massive. Please, disease from it. And some people, they will stop their blood pressure, they will stop their blood pressure medication, they will keep taking aspirin. That is a fast lane to stroke. Please, let's desist from that. Take your blood pressure drugs, all right? And don't lay too much emphasis on aspirin. Yes, aspirin has its own side. We're not disputing that, but it is not a magic drug. It is not an all-in-all drug. Please let us be guided. All right, don't throw your blood pressure somewhere, your blood pressure medication somewhere, and then keep taking aspirin. You may be injuring yourself and not know. Okay, Salome Omole, do you have a question? Your mic is unmuted.
No, sir.
Okay, thank you very much. We're trying to, yeah, it's 2 minutes after 8 now. We should be rounding up. Well, we're trying to answer all the questions. Somebody said we have missed out some questions, but I can see that my colleague has been frantically trying to answer all the questions, and I hope that will suffice. If there are other questions you need to, in the next 2 minutes, we should round up, but let's see how we can. Dr. Olusegun Joseph, you skipped my question. Engineer Oladipupo, I need to go look up for your question. What can an elevated pulse lead to? And if it's due to anxiety, is it harmful? Yeah, an elevated pulse, can make your heart to beat and make you aware of your heartbeats. You can have palpitation. That is something that can give someone some form of discomfort. All right. And in some ways, just like we said, pulse rate, if it's high, it can impact on your cardiac output, and your cardiac output can impact on blood pressure. So sometimes the blood pressure is it harmless. Okay, I think it's been answered. Oladipupo, see whether I can see, whether I can see that question. Or if you don't mind, sir, can you just raise your electronic hand so that the host can unmute you? Because so that the host can unmute you and you can ask the question live, because I seem not to. The questions have been coming in, in the torrents, and I'm not sure I can see it. I'm still scrolling. Please, host, can you help unmute Oladipupo? I'm sorry, I can't find it. Or you can retype the question so that it comes to the fore, and then we can deal with it. At what interface is best to take blood pressure, before or after food? Doesn't really matter. You can, but before food is fine. I mean, you wake up before you eat, because when you eat, blood can get diverted to your GIT, and then depending on the kind of food you eat, your blood pressure can go up, or in rare occasions it can go down, but more often than not, I mean, it tends to go up because of the salt content. All right. Okay, your questions are answered. All right, thank you very much. Okay, I think we've come to the end of Felix.
Yes, good evening. My question, right? I want to know what are the implications of having vascular elasticity being.
Okay, Os, kindly help me unmute Felix Osioni quickly. We want to round up. Yeah, go on.
Can you hear me? So, what are the implications of having vascular?
Can you speak up, sir? We can't hear you.
What are the implications of having vascular elasticity being moderately abnormal, and even myocardial oxygen consumption abnormal? What is the impact on the heart?
Yeah, so if your vascular elasticity is abnormal, depending on what it is, if it's very much, constricted, the blood pressure will be elevated. All right.
Okay.
If it's extremely laxed, all right, then the blood pressure can be, will be impacted as well. It's likely going to be lower than maybe normal, or low. More often than not, it is the constricted stuff that impacts more and gives, increased blood pressure. All right.
Okay.
Vascular, you said vascular contractility. Yeah, if the heart is contracting, if the heart is not contracting well, if a chunk of the heart muscle has been affected, maybe by heart attack, of course, the heart muscles will be flabby, will be weak. It will not be able to contract well. The cardiac output will drop, all right, and the person can suffer from low blood pressure. I hope that answers your question.
Does that dictate to stroke or something, or heart attack?
Well, it depends. I mean, if there's a massive heart attack, apart from the person having the heart attack, the person can have stroke, because what it means is that the blood pressure can greatly reduce, and with a very low blood pressure, blood supply to the brain can be compromised, and the person can have a stroke. It's a possibility.
So what does that person need to do?
The kidneys too can. And the person needs, if a person has had, heart attack, the person must be in the hospital. He will be fighting between life and death. What do you say?
The person has not had that attack before, not even stroke before, but
the person needs to see the doctor. Or it's a report. You need to see a cardiologist as fast as possible, so that you can be properly evaluated and managed appropriately.
Okay.
So you can call the number on the chat box. You can be guided, maybe given an appointment or something. Yes, you're welcome. You're welcome, sir.
Thank you.
All right, thank you, everybody. Thank you for holding on. You've been such a wonderful people. We cannot take you for granted. Thank you for the patience. Thank you for the rapt attention. We hope that this session has been educative, informative. We hope that we have not wasted your time. If you have gotten value, you can just put it on the chat box. Let's know whether this session has been worth the while. We'll have our next meeting